Hi, I'm Dr. Irshad ENT specialist at Ishaq bin Omran Medical Center in Sharjah. I have an experience of around 20 years in the field at major hospitals in India, Dubai and Sharjah. Today we will discuss about sinuses and sinusitis. Sinuses are air-filled cavities present in the bones of face and skull around the nose. Sinuses open in the nose through small openings known as ostia. Any infection of the sinuses is known as sinusitis. There are a variety of sinus infections depending upon what causes them. This can be bacterial, fungal, granulomatous, specific or non-specific, or viral. The most common ones are the bacterial infections known as acute bacterial sinusitis. The function of sinuses is, apart from making the skull and face lighter, they also offer resonance to voice, are involved in warming of air and its humidification while breathing. Sinuses secrete a substance called as mucus, which drains out through the sinus openings into the nose. This is a stucky, proteinaceous material which lines the walls of sinuses and the nasal cavity. This is involved in trapping of small particles, dust, and bacteria, and also offers immunity by presenting it to the immune cells. The sinuses produce a sticky proteinaceous substance called mucus. This mucus also traps dust particles, bacteria and other foreign material, presenting it to the body's immune cells and offering protection from such infections. The passages and ostia which drain the mucus from the sinuses to the nose are very narrow and can get blocked easily. A block of the sinus passages or ostia leads to a lack of sinus drainage and a collection of secretions in the sinuses, which can get secondarily infected by bacteria, and this leads to sinusitis. A bacterial sinusitis, once established, is characterized by symptoms of headache, blocked nose, running nose, postnasal discharge, anosmia, which is lack of smell or decreased sense of smell, with associated features of fever, body aches, weakness or myalgias, throat irritation. A presence of any two of the major symptoms and one minor symptom establishes the diagnosis of acute sinusitis. To clinically diagnose sinusitis is fairly simple. It can be done on a routine clinical examination in the OPD with an endoscopic nasal examination, or at the most an X-ray sinus confirming the diagnosis. The treatment of acute bacterial sinusitis is fairly straightforward, with most cases responding well to medications. In cases where there is a lack of response to repeated use of medicines, or where there are cases of relapsing or recurrent sinusitis, then such patients would need to be investigated further to find out the underlying causes. Based upon these causes, the treatment might be a surgical correction of the underlying anatomy to give them a long-term relief. We at Ishaq bin Omran Medical Center are offering the entire range of treatment, from medicines to a surgical correction for long-term relief of sinus disease and providing you with good health and a better quality of life. Thank you.